Hello, my name is Dr. George Mayzell, and I'm representing Healthcare Experience Foundation in conjunction with Maryland Healthcare Education Institute. And we've composed a number of programs for you that talk about compassion care in this very difficult time while we're all trying to thrive in the crisis of COVID-19. The objectives for today's program are to talk about the new normal, review attributes of the survivors, and learn ways to sustain and build your personal resilience. So let's look back in the last few weeks of what's happened. Certainly a different time than any of us could have anticipated. We've seen new demand for ER services and hospital services. We've seen doctors, physicians, and healthcare workers making life and death decisions on a daily basis. We've also seen new worries about self, family health, well-being, and personal finances. And we've seen information overload and, probably equally as important, misinformation overload. So let's talk about where we're starting and how we handle this crisis. I'm going to start at the lower part of this chart and talk about the fear zone, the starting point. This is where a lot of folks have started when this crisis first came to light. I get mad or frustrated easily. I complain. My emotions are on my sleeve. This is not a very helpful place to be. And so as we acknowledge this and learn from it, we move up into what's called the learning zone. This is where I'm at peace with what I can't control. I can hold on and identify my emotions and control them. I can evaluate information before sharing it. And I can recognize that everybody's trying to do their best. And then finally, we move into the growth zone, where we start thinking of others and how we can help them, empathy, instead of just sympathy, and thanking and appreciate others' work and efforts, and speaking positively and looking for new ways to cope and adapt. So let's talk about some definitions. The term resiliency has been around for a while, but in healthcare, we're really talking about the process of adapting well in the face of adversity, trauma, or tragedy. Certainly COVID-19 qualifies for this, and people bring in their own resiliency and have to create more resiliency to continue on this path. It does not mean you won't experience difficulty or stress. That's part of the growing process. So resiliency actually gives us power. Trauma survivors actually bounce back and thrive after the trauma. Some recover and find all new callings, new missions, new goals. Some embrace new lofty goals and really change their self for the positive. They pursue progressive changes. Life will certainly be different after COVID-19 for all of us, especially of those of us in healthcare. So first, let's check our airbags. What helps protect us, and what personal mechanisms do we use to help protect us and our colleagues? What helps us build resilience? First of all, supportive relationships. Next, carrying out meaningful plans, being self-aware. A positive view of yourself and confidence in your abilities. And of course, taking care of yourself first. Lastly, communication and problem solving, and managing feelings and impulses, i.e. emotional intelligence. So let's break these down individually, talking about caring and supportive relationships. What do you look for in support and care? One of the critical pieces here are peers and colleagues, obviously family as well. Certainly being able to communicate with each other at work is a critical piece. What needs your attention? Are they supportive? Look at some of these stressors and surround yourself with people that can help lift you up in a very positive way. Making and carrying out meaningful plans, reminding yourself of the why. Where are you finding purpose? And how can you support others with their purpose? It's really looking deep and saying, why are you doing what you're doing? A positive view of yourself and confidence in your abilities. As Muhammad Ali said, I am the greatest. I said that even before I knew that I really was. The challenge in healthcare is showing your patients, peers, staff, and other folks that you work with that confidence without appearing arrogance. Was your training and experience prepared you for this? What makes you uniquely capable of being successful in this environment? Communication and problem-solving skills. What's your communication style? Be in the present. Thank you to all. and select a few reliable communication sources. There's a lot of misinformation out there. Focus on the things that you know are reliable and don't listen to the news all day. Pick a few stations or a few sources online and use those as your trusted sources. Managing strong feelings and impulses. Certainly, this crisis has brought a lot of emotions to the surface, and all of us are going to have strong feelings that we have to deal with. Count to 10, wait a few minutes, or in the case of electronic communication, use the 24-hour rule. Write your email, send your note, but don't actually send it. Just put it in the hold file and send it a day later if you still mean it. Give yourself time to decompress. Know you're going to have strong feelings and figure out the best way that you can deal with them without imparting them directly on others. So let's talk about some tips for resilience and, importantly, taking care of yourself first. As we say in the emergency room, take your own pulse first. First of all, the obvious things of physically taking care of yourself. Eat well, get some sleep, and you may not be able to actually get exercise, but at least take some walks around, get away from the unit, walk around the outside of the hospital, just get some alone time and at least a little physical exercise. Emotional. Be gentle with yourself. This is a tough time. Look for others, particularly peers who are going through the same thing. Develop a personal practice that refreshes you and stay connected virtually. Next is professional. Know your priorities and focus. Try to stay out of crisis mode by planning your day and controlling what you can control. And ask yourself daily, what brings me joy? You and others are all counting on you. Remember, it's the same boiling water that softens the potato as hardens the egg. It's not about circumstances, but rather what you are made of. Thank you for listening. I appreciate your help and support during this very difficult and challenging time dealing with the coronavirus.